Next up, let's welcome anchor Buddy Fry. He supports many of South Florida's local nonprofit organizations like Julian's Fountain of Youth and the Stonewall National Library and Museum. Buddy, Holy Cross is going to host LGBTQ plus trauma care webinar on July 30th. Tell me what's happening out.
Well, Faye, on Wednesday, July 30th from 12 to 2 p.m., Holy Cross Health's Community Health and Well-Being Department will host a national webinar in collaboration with Equality Florida. The online event, called Trauma-Informed Care for LGBTQ Patients, will train healthcare professionals to recognize trauma responses and create safer clinical spaces. Participants will explore how past trauma, particularly in healthcare settings, can affect LGBTQ patients' trust and outcomes. The session will offer practical strategies for reducing harm across all healthcare roles. Eligible attendees may also earn 2 IPCE continuing education hours. Registration is open to providers across the country. For more details, visit holy-cross.com. Now, this is something above my educational background, but I hear that it's very well attended, and Vaughn would be the expert on this, since it's his organization
Vaughn,
sponsoring it.
Again, when I saw this, I was like, wow, I was blown away because, I mean, we're constantly talking to friends and family that have issues when it comes to healthcare, right? And I'm the first one to say, hey, go somewhere where they have LGBTQ plus trained healthcare professionals. And you would be surprised as to how many are not, you know? And so trauma right there, we've all got some kind of trauma, and there's so many different things that can trigger us in any way, shape, or form, like going to a doctor to let them know what's going on with you, you know? So how does this all work?
Well, you know, we were part of, obviously, the HEI, Health Equity Index, that we scored a very high score on, and through the HRC. And part of the training is making sure your staff, your organization, even your leaders, executive leadership, have been trained on trauma-informed care, on compassionate care, making sure that you're addressing everyone, but also you do know how to address our transgender community, our lesbian communities. You know how to talk to them about their pronouns. And a lot of this is them trying to understand, we have to, as individuals, and I'll say we as patients, right? Have we dealt with our own trauma in our lives? And the idea is, if you sit across from someone, you always have to look at the other side, right? What's keeping them from accessing their health care? What's keeping them from doing what they need to do? And it's something they haven't dealt with themselves. And if you understand that, it's easier to deal with individuals that way. And I think, you know, Equality Florida has developed this great program working with HRC and us, and it's any healthcare professional can do this webinar. So it's going to be a great event.
Okay.
You know, it was nice to see Equality Florida in there. And, like, you know, I feel almost troubled to mention this with Equality Florida of, I have nothing bad to say about Equality Florida. That's so unlike me with the progressive. Woohoo! They've really been doing a great job the last few years, and it's just great to see them doing stuff like this.
But what's even more important is when you come across a group like this or a moment like this, I mean, a patient typically is in an emergency situation, a high-stress situation. They don't feel good. They're grumpy. They're in pain. They're confused because you're having all this stuff being talked around you, over you, and through you. So situations like this, it just makes it much more viable and visible for us.
Yeah.
And it's a way, if you think about it, we need to look at, you know, obviously with our political climate we've got going on right now of gender, you know, we have to find a way of being gender neutral, right? It's almost like, you know, it's just almost like care and treatment, like HIV treatment. You know, you're treating it the same whether you're on PrEP or you're on medication for HIV. It's a status neutral approach. And that's the way we need to approach people and help them through their trauma. I mean, we got a lot of youth. Obviously, in an emergency situation, that's going to be very difficult in some cases.
But still, you have to be respectful.
But still, you have to be respectful. I mean, and there are, you know, I love healthcare workers. I'm married to one, right? So, but I also know a lot of healthcare workers that are stuck up and have all kinds of ego and are like, I don't want to learn shit. And I don't need to learn anything, and that, so things like this are so important for those that do want to help our community, for those that are there to give care to our community. You've got to know what the right questions are, and then certain answers might mean that you might need to get other help for this patient, These are things that we need to, that as a patient, we deserve it.
Well, we don't always know.
And we don't always know.
To ask. We don't know how to ask. We're in a vulnerable situation where we're trusting the system to do what's right for us, not decide for us and then not include us.
Yeah.
Yeah, which is so many times happening, unfortunately. And Queer News Tonight looks forward to seeing you all, if you are a healthcare person, to please be part of this webinar for trauma-informed care for LGBTQ patients on July 30th from Holy Cross. And that is the big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.